Coming up in today's video, guys, we've got 3 patients in this compilation, all with really big, large, kind of sticky wax plugs. My name is Taylor Green. I'm one of the audiologists here at Audiology Associates. Now, the first patient you're seeing here is going to be Katie's patient. The second patient is going to be mine. Third patient is going to be Rhys's. So you got one from all 3 of us today. As you can see, it is just myself for today. You're going to have myself as well for the next couple of videos. Rhys is okay. He's just a very, very busy man. So there's a lot of meetings he's having to do at the moment. So just kind of voicing these over by myself just to help out. Now, Katie's got the standard size on the tube here. Now you can see we've got this very thick, kind of sticky, stretchy plug that's in here. What looks like a bit of a mixture of wax and skin. So you've got this lighter material on the on the sort of front section here, which is going to be that dry skin. And then you've got this center core then, which is going to be more of the wax that's been building up in this ear canal. It looks quite deep as well. Like quite a long plug. So Katie's just giving this a little bit of a wiggle. Like these kind of wiggling motions you tend to see us do with the suction. It does really help to unstick these plugs from the ear canal. Because what you tend to find, if there is a lot of dry skin or dead skin in the ear canal, it tends to be attached sort of a lot further into the ear canal. So that's why you generally tend to see us doing these sort of like wiggling motions to try and loosen everything up. It's not as long as what I was expecting, to be honest. Like I'm watching this live as the same as what you are as well, guys. So you can see the back end of this. It's got a lot of that dead, dry skin there. Look, that was what was still attached to the ear canal. So the suction's going to break that away quite nicely now. Bit of a wiggle. Here's a stretchy one. Oh, you can see that starting to peel going up around the side of the ear canal. These ones with all this this dead skin, they can be very difficult to remove just purely for this reason. So you tend to get all the wax away, which is great. You've unblocked the ear canal. But what you sometimes end up with is what you can see here. So this is more what we would class as keratin. So it's a harder type of skin in the ear. Now, oh, that's sheared away quite nicely there. I was just going to say, what you tend to find works quite well with this skin is the olive oil. So we will sometimes use olive oil on the day of the appointment, and that just helps us to remove this skin a lot more comfortably and a lot easier as well, because they tend to pull quite a bit. Members will know, if you're watching this video, I mentioned on the last video that patients may sometimes feel a bit of a pulling sensation when we're taking this skin away. And some people, some people are fine with it. Some people quite like it. But some patients, they're a little bit more sensitive to it. So the oil helps us to just peel it away a little bit easier. And we've got a 2 centimeter tadpole wax there. So this is my patient now. So you can see a completely different kind of consistency here. We've got this darker, sticky kind of wax now in this ear canal. So I've got the standard size Zollner tube, which is the larger of the suction tubes that we use here. Now, I generally, with these big plugs, I tend to start from the bottom to try and lift and detach it off the ear canal, which has worked quite well here. Quite a big piece of wax has come out there. And you can already see this ear canal is looking a lot clearer. Patient hearing a lot better. There was a little gap you could see above the wax, so the patient probably wasn't feeling completely blocked up at the time of the appointment. But it's quite likely, if this wax had been moving around a little bit, what you will tend to find yourself is that you may have a bit of intermittent hearing. So you'll be fine 1 minute, and then you may have a bath or a shower, feel really blocked up for a couple of hours. You may wake up with your hearing feeling really muffled. So that's basically why, it's definitely worth getting your ears checked. So if you generally tend to have any problems yourself with intermittent hearing, any discomfort, any strange out of the ordinary issues with your ears, just book yourself an appointment with the nearest audiologist and get them to have a little look. Don't leave it you know, don't just leave it and say, oh, you know, it's going to clear up by itself. You know, it's definitely worth getting checked as soon as possible, especially if there's discomfort and pain there. So it's very similar on the other side here. If anything, it's a bit more dry this side. The patient wasn't having any hearing issues here. You could see there was a larger gap. You could actually see the eardrum right at the start of this particular removal. But, you know, I did explain to the patient, like, I know you're not having any hearing issues, but there is a significant amount of wax in there. I'm not just going to leave that in there. So we've got the wry curette here now. We're basically just trying to roll this earwax out. I'm having to put a little bit of pressure on this to get this squeezing through the entrance. The patient hasn't used any oil this side, so you can see the consistency difference. This is like a nugget, a really hard kind of nugget of earwax here. Just going to use the hook to pick this up. There we go. It turned out to be a very similar size to the other side, even though there was a little bit more space. There we are, almost identical twins there. We've got, what's that, centimetre and a half, half an inch of earwax there. So this is Rhys's patient now. This is the last patient in the compilation. Now, from what I can see, I'm watching this live with you. I don't know the backstory of this particular patient, but what looks to be very, very similar to Katie's video at the start of the video. We've got this plug now, very narrow ear canal as well, quite small ear canals here, which is, you know, is gonna make things a little bit more difficult because it's not going to allow much space for us to maneuver this wax around. So what we're going to have to do in a lot of cases is try and break little bits off this wax. We're quite lucky. This looks like it is actually starting to move quite nicely, but sometimes we have to create a little bit more space, try and break little bits away, and then start pulling forwards. But that's come away nicely. Oh yeah, we got a tiny, tiny little spot here now, which looks like dry skin. Yeah, there you go. Eardrum though is looking really good. Oh, you can see this, the patient looks like they've been using drops this side. You can see it's quite wet looking here. Oh, look at that ear canal. It's like almost collapsed. There we go. This is the standard size ulnar tube again. Oh, I just got to try and maneuver this wax now around that little bend in the ear canal. Not the easiest of things to do. Here we go. Oh, there it comes. I was just going to say, I can see Rhys is trying to get that good grip. Yeah, there's a nice piece of wax there, and that's looking really good. Yeah, always tricky with those kind of bendy ear canals. They're not the easiest of ones to do. Well, guys, thank you. I hope you enjoy watching the video. We've got 2 questions now, which we have in Question Corner. So we usually put 2 questions up every video, and we'll answer them to the best of our abilities. Now, the first one we've got is from Claudia. I'm going to have to come a bit closer here. I can't see it right in. Does anyone know if Mr. B or Taylor have ever mentioned if having narrow ear canals could be the cause of earwax not migrating down the canal like it should? The answer is yes. You know, we have mentioned it a few times on some videos in the past. What you'll tend to find is the patients with the really narrow ear canals is exactly as you've just mentioned. The skin will try and grow from the eardrum. Now, the skin grows sort of along the surface of the eardrum, kind of angle it so you can see it better. It kind of grows along the eardrum, down the ear canals, and that is what normally tries to clear your earwax naturally without using any like oils. But when the ear canals are very, very narrow, there's not a lot that the ears can do by themselves. So yeah, you know, you are right in saying that it will, you know, affect the migration of the skin and the wax. And these patients are usually quite likely having to have their earwax removed around every 3 to 6 months. We do see it quite often in clinic. Second question there we've got from LXDY Gray 3743. Have you guys ever had a case where someone had different earwax texture, consistency in their ears? For example, one ear would have wet, mushy wax while the other was dry and brittle. Thank you for your question. And again, very similar to the first question we've had from Claudia. Yes, you know, there's several videos that we've done in the past where, you know, we have had two different types of consistencies. Usually it is from the drops that the patient tends to use before coming in. So we get a lot of patients where, like this video actually, where we sometimes get patients where they don't feel there's a problem with one side, but they're feeling a little bit blocked up in the other. So they'll mainly use a lot of drops in that one that they're having problems with. So when they do turn up to clinic, funny enough, like you've seen in this video, we usually get wax where it's kind of softer in the one and quite solid in the other. That can also happen with, you know, some people's natural earwax. We've had a lot of patients where there's nothing in the one ear canal and then completely full in the other. And again, we've had it on occasion where someone has like eczema in the ear. Sometimes the eczema can be quite wet. There'll be a lot of that like mushy skin in there, whereas the other one will be really dry and crumbly. So yeah, we do see that quite often. So thank you very much for your questions, guys. I forgot to mention during the video, but if you do like watching these types of videos, don't forget you can share, you can like, you can heart, you can follow. We appreciate every single one of you. And yeah, just take care of yourselves, guys, and we'll see you on the next video. Thanks, everyone.